I'm Dr. Joseph Shvidler, and I'm a double board certified facial plastic surgeon currently practicing at the Seattle Facial Plastic Surgery Center in Seattle, Washington. So removing a dorsal hump is probably one of the most common requests that a patient asks when it comes to rhinoplasty. It usually involves approaching the nasal tissues via an open or closed approach, most commonly closed approach, and removing the cartilaginous and bony portion of the hump, and subsequently bringing the nasal bones together to recreate the pyramid. When it comes to closing, we call this an open roof. Imagine a structure looking like a volcano with a cap missing. So that means we took the bump off, but now there's bones and there's sort of the flap trapezoid structure that's in place. We need to bring the bones together to recreate that pyramid structure of the nose. And the way we do that, we make little cuts in the bones and push the bones together. And then after that, the bones are held together with a cast. The reason we put the cast in is so we can push the bones together until they heal, so they stay in that triangular shape. So when patients take the cast off, they immediately see the change when the bump is definitely less. It may be a little bit swollen still from the healing process. Sometimes patients see a little bit of bruising over the skin of their nose, but overall they see the result right away and they're super happy about the change. That again is something that I really look forward to every day I do this. In rare instances, there's a thing called pseudohump, where you think you have a bump and it needs to be removed, but in actuality you have the lower portion of your nose is depressed, so it gives you an illusion that you have this bump, but you actually need the lower portion of your nose that is saddled to be built up instead of the bump taking down. And again, this is where my expertise comes in as a facial plastic surgeon, and my job is to educate you about that particular situation and offer solutions for that. So sometimes we take the bump down, and sometimes we actually build up other areas in the lower third of the nose and also in between the nose and the forehead to kind of camouflage or hide that bump. So there's several ways we can get rid of the bump.